The annual physical is an old ritual that a lot of people take for granted, but there's actually very little proof that it does any good. We know that it is helpful to have a session, maybe once a year, depending on your age, to look at what screening tests you might be due for and that sort of thing. And that's what Medicare did. Medicare never did pay for physicals. They only paid for sick care. But they did introduce what they call the annual wellness visit, which is a very heavy-handed protocol of screening questions that you have to ask people. Medicare wants that so badly they pay the doctor extra and they make it free for the patient. Managed Medicare, like WellCare and Martin's Point and so forth, and commercial insurances generally do pay for a physical, even though the evidence is not necessarily there to support it. And I'm going to come back to the evidence. And what's ironic is that you can have random blood work with a physical if you have commercial insurance like Anthem or Cigna or Aetna, with no copay. Whereas if you feel sick and are worried that there's something wrong with you, you actually have deductibles and copays to deal with in order to find out what is the matter with you. A lot of the things we do or used to with an annual physical exam was hands-on, and I have written elsewhere, and many other people have written too, that doctors are rushing through physical exams and not necessarily doing a good job with it, and that most of the time, if somebody is ill, the history of the symptoms gives the diagnosis rather than the physical exam. You might have to check a couple of things after you listen to what's wrong. But the yield, if somebody feels well, the yield of doing random bodily exams is extremely low, and those exams are often not done well, and that adds to the low value of doing a physical. For example, if somebody goes to the eye doctor every year, there's not much point in us doing the eye exam. If they can hear okay, why would we look in their ears? And a lot of the things that we thought were valuable have not panned out. For example, the U.S. Public Health Service Task Force on Prevention does not recommend that the doctor or the woman herself perform a breast exam at any regular interval. It is no longer recommended to do a self-exam of the testicles for testicular cancer. I always tell people I've seen 3 or 4 cases in my 42-year career of testicular cancer. I've been diligent in looking for it, but the disease is rare enough that to scare all men that they have to check every month for that yields very little in terms of improved survival, but it certainly adds to the worry and the cost of looking for this disease. The rubber glove trick to check the prostate and get a stool sample for blood has also fallen by the wayside. It is no longer recommended by the U.S. Public Health Service Task Force on Prevention. And PSA testing was a favorite, then it fell out of favor, and now we're somewhere in the in-between gray zone of what the value of that might be. The real value of an annual physical is to sit down once a year and look at the screening tests and also look at health habits and do a review of systems. That's really where the value is. People sometimes don't take the time to go to the doctors because of these little things that have been nagging them. But if they're going anyway, that might be an opportunity to say, you know what, I've had this nagging cough, or I've got this funny pain that doesn't make any sense to me. And those things could be important to investigate. So I think that it is important to have a relationship with your medical provider. And the word physical kind of sticks, but I think it's important to understand that it is the ongoing relationship, the review of systems, and some sort of checklist of, do you want a pneumonia shot, and those types of things. That's where the value is of the annual exam. For many offices, it is also important to see people once a year, not only because you have a certain responsibility. If you're treating somebody's blood pressure or asthma and they don't come in very often, how do you know they're well controlled? But also, for example, in the type of clinic that I work in, we're a federally qualified health center. We get grant money to help us offer sliding fee scales and things like that for people who might not afford to get health care because of lack of insurance. We have to report every year how many patients did we see in the past year. If everybody comes in every year, they get counted, and that helps our grant money and our ability to support our community's lesser endowed patients. If people come in every 18 or 24 months, they fall off the roster and our grant money decreases. So I personally insist that if you're getting medications, we really need to see you. I don't care if we do a physical, but we need to know you're okay, and we need to know your medications are the right ones for what we are treating. So I would suggest that we call it an annual review, if you don't have Medicare where it's an annual wellness visit, and de-emphasize the physical. It's really in the conversation, in the relationship between doctor and patient, that the value of meeting annually still exists.